What are the complications of prematurity?
Premature babies have a roller coaster ride. They tend to gradually improve in the first few days, but these are interrupted by certain minor complications, and some complications can be severe as well. I'll explain to you with regards to one or two major organ systems. For example, the most problematic organ with regards to premature babies is the baby's lungs. The lungs are pretty weak for premature babies, and they may not have enough power to breathe in oxygen and breathe out carbon dioxide. Hence, we need special techniques to help them with their breathing. We give them a medicine called as surfactant, which went directly into the baby's lungs through the baby's windpipe. And this medicine is supposed to improve the baby's breathing efforts. The other complications are the babies can also have problems with their heart. Some babies develop low blood pressure, for which we need to support them with medicines. So these are particularly seen in babies born before the 28th week of pregnancy. With regards to the heart, there is an important structure called as the ductus arteriosus, which is a narrow tube connecting the two major blood vessels in the heart, known as the pulmonary artery and the aorta. So normally, all the babies will have this duct open as long as they're in the mother's womb. Once they are born, this tube has to close. Sometimes in premature babies, the tube does not close on its own, and this can lead on to various complications. Hence, we need to try and use certain medications to try and close this duct artificially. So the non-closure of this ductus arteriosus is called as patent ductus arteriosus and can lead on to various complications. The other thing is the babies born yearly can have problems with bleeding into their brain. So this is primarily because the blood vessels in the brain are very fragile. So any movement or any sudden changes in the blood pressure in the baby can cause these fragile blood vessels to rupture and leak into the brain. So this is called as intracerebral hemorrhage, or in other words, it is called as bleeding into the brain. So this can lead on to various complications, especially in the long term when the bleeding is very severe and extending to large parts of the brain. Again, we need to ideally prevent this, but if this happens, we need to monitor the baby's head very carefully with bedside head ultrasound scans, which should be done on a regular basis. The other complication which can happen is with regards to feeding the babies. Some of these babies have major problems with regards to digestion of milk. So overloading them with milk can lead on to several problems such as feed intolerance. The one major dreaded complication of neonatologists is called as necrotizing enterocolitis, which means that there is an infection and inflammation of the small bowel or the gut of the baby. So when this happens, the intestine starts becoming atrophied, and they start losing their function. So basically the intestine stops working, and hence the babies cannot digest their milk. Once this happens, we need to treat it aggressively because it can cause death in a baby, especially in preterm babies. So we have to stop feeding the baby and use very severe high order antibiotics in order to control this infection. One more complication which can happen in preterm babies is infection. With regards to infection, many preterm babies have a very poor immune system, so their resistance power is quite low when compared to another baby born at full term. Hence, they are very likely to catch up even ordinary infections which can be prevented in a term baby. So for this reason, we need to always be watching the preterm babies whether they are having any developing any symptoms of infection. So once if there is an infection, we have to treat the baby with antibiotics for a period of time, say for example 1 week to 10 days in order to eradicate this infection. But however, we will make sure that we try and prevent the infection from happening, because prevention is always better than treatment. We try and ensure that all the doctors and nurses and other visitors visiting the NICU will wash their hands and scrub their hands with alcohol-based scrubs in order to disinfect themselves. But in spite of this, from time to time, we do have babies who develop infection, and we need to be aggressively treating these infections.
Thank you, doctor. Thank you for helping us understand about prematurity.
Okay,